Respond to a motor vehicle accident on the highway. A report of a rollover with passenger ejection.
Okay.
Are there any acronyms you'd like to state prior to your time starting?
So AVPU, DCAT, BTLS, BSI, Penman, Dr. Germ, PMSCs. Okay, those. Okay, I think that's it. Okay, so it's body substance isolation. Oh, PPE, personal protective equipment. Dr. Germ is distension, rigidity, eviscerations, rebound, tenderness, and masses.
Okay, you said AVPU, but you didn't state what AVPU was.
Oh, alert, verbal, painful, and responsive.
Okay, what's DCAT, BTLS?
Deformities, contusions, abrasions, burns, tenderness, lacerations, and swelling.
That is incorrect. Go ahead and say it again.
Deformities.
You missed the P.
Oh, deformities, contusions, abrasions, burns.
You missed the P again.
Deformities, contusions. Deformities, contusions, abrasions, punctures and penetrations, burns, tenderness, lacerations, and swelling.
That's correct. You mentioned BSI, but not Penman. Go ahead and state Penman.
Personal, partner, patient, public safety, environmental hazards, number of patients, mechanism of injury or nature of illness, additional resources needed, and then need for extrication, extraction, or C-spine.
Okay, what's PMSC? You mentioned that.
Pulse, motor, sensory, cap refill.
Okay, are there any other acronyms you're going to use? Maybe TIC?
TIC. Tenderness, instability, crepitus.
Okay, anything else?
ABC means airway, breathing, circulation. ALOC means altered level of consciousness. Z-track means when you pull a patient down in Z motion while holding cervical stabilization of the C-spine, like without injuring it.
Okay.
And then I think that's it.
All right. So again, you respond to a motor vehicle accident, report of a rollover with passenger ejection.
Okay,
You're right on scene. Go ahead and start with BSI Penman.
Okay, so BSI Penman, I would approach by the feet, get a general impression, which would be 24-year-old male.
Don't make anything up. I didn't tell you that.
Oh, age, sex, weight, position found.
What else?
Then I would check his AVPU.
No, stop. We're still at general impression. You said age, weight, sex. I'm going to give you that.
Position found. And
So,
then
42-year-old male, approximately 110 kilograms.
Okay.
Are you checking something else?
If there's any left threats, or then I would delegate my partners for preparation of backboard and C-spine stabilization.
Okay. Go ahead and continue.
And then I would do AVPU, so it'd be alert, verbal, painful.
He's not alert, or he's not tracking you. Go ahead and continue.
Okay. So, and I would do a trap squeeze.
He wakes up to painful stimuli. He is confused.
Okay. So then I would start with ABCs, check his airway, if it's open, clear, maintainable. Need for suction or any airway adjuncts.
It is open but not maintainable. No need for suction.
Okay, so then I would give him OPA, and I would check from the earlobe to the top, to the corner of the mouth.
Okay, he accepts the OPA. Go ahead and continue.
Okay. Then I would check his depth, rate, ease, SpO2.
Say that again. Slow down.
For his breathing, I would check his depth, rate, ease, SpO2, and then I would assess his lung sounds.
Okay. So his breathing rate is fast, shallow, and labored. Diminished on the left side. SpO2 is 88.
Okay. So then I would give him a non-rebreather mask. I'd turn it on, and then I'd put it at 15 or at 10. I'd fill it up. Put it around, and then I would pull these. Okay, then after that, I would check his circulation, see if, check his color, moisture, temperature, cap refill.
What are you checking for circulation?
Rate, rhythm, quality, cap refill, skin size, color, moisture, temperature.
You stop right there. I'm going to give you some information. His rate is fast, rhythm is regular, quality is weak, skin signs are pale, diaphoretic, and cool. Go ahead and continue.
Okay, and then I would cut and expose for any life-threatening hemorrhaging.
There's no life-threatening hemorrhaging.
Okay, after that, I would go into my first transport decision, which would be altered level of consciousness, compromised ABCs, and any uncontrolled hemorrhaging. So I would transport immediately.
Why are you transporting?
Because he has an altered level of consciousness and he has compromised ABCs.
Okay, go ahead and continue.
Okay, so then I would expose and observe the head for decap BTLS, and then I would palpate, check my gloves for blood. Then I would expose and observe for decap BTLS on the neck, and I would check for jugular, tracheal deviation, jugular vein distension, stoma, subcutaneous emphysema, and medical alert tags. Then I would check the posterior for step off and point tenderness, and I would check my gloves for blood. And after that, I would delegate my partner for size and placement of the C-collar.
Your partner's busy. Go ahead and place the C-collar.
Okay, so I would measure this. And then I would expose and observe the chest. For decap BTLS, I would check for impaled objects, flail segment, sucking chest wound, and paradoxical movement. And then I would palpate lateral to medial, anterior to posterior.
Okay, go ahead and demonstrate. Is there anything else you're doing at the chest?
Excuse me?
Is there anything else you're doing at the chest?
I would auscultate lung sounds.
Show me where.
I would check lateral to medial, mid-axillary.
Okay.
And then I would
So
check.
we're going to stop right there. As you're assessing the chest, you discover a gunshot wound resulting in a sucking chest wound. How would you treat that?
I would apply pressure, and then I would apply pressure, and then cover it in moisture or gauze and like tape it or use I don't know that one.
Okay, so we'll just come back to the abdomen. Go ahead and continue.
Okay, so then I would expose and observe the abdomen for Dr. Germ, and then I would palpate lateral to medial. I'd palpate.
Go ahead and show me, demonstrate.
So it'd be 4 quadrants. I palpate right here, and then I would expose and observe the pelvis for decap BTLS, and I would be checking for priapism, vaginal discharge, and incontinence, and then I would palpate lateral to medium, anterior to posterior.
Go ahead and demonstrate.
And then I would expose and observe for DGAT BTLS on the thighs. And I would do that by doing offset pressure. I would go on the lower extremities and expose and observe for DGAT BTLS and palpate using offset pressure as well. Then right after that, I'd expose and observe the upper extremities for DGAT BTLS using offset pressure. And then I would cut and expose for any life-threatening hemorrhaging. And then after that, I would make my second transport decision, which would be bilateral or femur fractures, unstable pelvis, and God damn it, chest injuries. And then I would assess my partner for full set of vitals.
So we'll stop right there real quick so we can talk a little bit.